Hey, this is Eric Durek, and welcome to this episode of Med Health Fit, the TV show that integrates wellness and healthcare. And over the last season, we've spent quite a bit of time talking with people in the field of alternative medicine, health insurance, sports medicine. And tonight, I thought I'd change direction a little bit and actually talk about healthcare. And the title of tonight's episode is called Solving the Healthcare Crisis One Rep at a Time. And the reason I say one rep at a time is because we're going to be really talking about how wellness and exercise can be a real integral part of today's and tomorrow's healthcare system. Now, all you need to do is turn on television every day and look to see what's wrong with healthcare. We have almost every morning TV show and evening TV show advertises prescription drugs on demand. We have drugs, children taking drugs, old people taking drugs. I think the average American now is on one medication, and people over 60 are on 3 or 4 medications at a minimum. And recently, with the opioid crisis, we see that the tremendous prescription of pain medications has had created this whirlwind of crisis within healthcare. So the question is, what needs to be done? Now, do we need to just go to all the pharmaceutical companies and tell them no more? You can't do any more commercials, and you can't do things the way that you've been doing them. I don't necessarily know that that's going to work. So what we're interested in doing is creating relationships. And this lecture, this program tonight is really going to try to put the foundation on developing a relationship that's been about 30 years in the making into more of an accelerated process that is going to be beneficial for everyone involved. The people on the wellness side who are delivering the products and services, the people on the healthcare side who are paying for them, who are looking for kind of a better way to do things, and the consumers, the American population, who have been only given a few choices over the last half century. And now I think we have a few different things that we can do with regards to giving them options that I think are going to work for everyone. So let's go to our first slide here. And I'm going to apologize at the onset for some small type, but there's a lot of information that I want to get through tonight. And the first thing I want to talk about is a company from Minnesota named Optum. And Optum is a large health plan, and what they have done is they've kind of transformed themselves over the years from a health plan that pretty much delivers certain types of medical services to more of a commercial behavioral health and population health management corporation. And the description here is that they're one of the nation's largest health plan companies. They serve millions of people all over the United States. And one of their main operation components over the last probably 5 to 8 years is this concept called population health management and data analytics. So I'm going to drill down on that here on this slide, so kind of stay with me here. Optum is reporting in a very recent white paper that they put out to some of their consumers, myself being one of them, of how they will change the current rising costs associated with healthcare through their attention to quality. And they're going to define quality in one big fell swoop as population health management and how they actually look at data. And let me sort of preface that by saying that there are thousands of medical journals in the United States that are published every month. There are thousands more that are published online that people can read. And I think that in the course of most physicians and health practitioners' career, which may span 30 or 35 years, they may read somewhere between 8,000 and 20,000 journal articles. And the interesting thing about data analytics these days is that a computer with artificial intelligence can actually scan through millions of specific types of research articles within the span of a few seconds. It can actually bring up the most concurrent and complete resources that the physician or the allied health practitioner is going to need in order to help this patient. and they don't have to do all of the searching themselves. So the field of data analytics and population health is becoming a tremendously important aspect of medicine because there's just too much information. As a matter of fact, I remember 10 years ago listening to someone give a lecture at a big healthcare conference, and they're saying that we have the world's greatest amount of knowledge right now, but we're drowning in data. In other words, there's just too much. We have to have a method right now to decipher what's going to be the best in terms of helping people. Okay? So I think that wellness can do as good or a better job than the current healthcare system in terms of how it's delivering what it's delivering. So we're going to make a comparison right now between the Optum formula of population health, data analytics, and healthcare cost management from pure healthcare to a wellness perspective. So let's see what we got. So the first part up here is healthcare. It's moving to what's called a value-based healthcare system. Well, what does that even mean? Well, health systems are trying to replace what's called fee-for-service with a value-based reimbursement. So let me discuss reimbursement. I know I've spoken about it in past episodes, but I want to talk about it in terms of the Optum perspective. Most people in healthcare, when they do a service, they get paid for it. Well, what if you're a doctor that operated on the wrong leg? Well, you'd still get paid for it. What if you're a doctor that gave the wrong prescription or not enough prescription? Well, you'd still get paid for it. That's what's called a fee for service. The amount of services and products that you do all have a coding system, and you submit the bill and you try to get paid for those. So they're going to be shifting to what's called value-based reimbursement, which means you have to do a good job. A person comes into a hospital, they have to like their service, the service has to be done on time, it has to be done at a rate that's kind of equivalent to other places around the region or the country, and that there aren't any complications or any bad things that have happened by virtue of those types of services. So systems that are introduced by Medicare, or what's called CMS today, underscore quality versus quantity of services, because under fee-for-service reimbursement, many healthcare professionals, they get paid for the number of services they do as opposed to the quality of services. So this is going to be a big shift in the field of healthcare, because a lot of people are going to be upset knowing that for years and years they would get reimbursed just for doing 5 or 6 different types of procedures. Now they may only get reimbursed for 1 or 2 of those procedures that actually work to the benefit of the patient and save the health plan a certain amount of money. So value-based models of care on patient outcomes, and they really will dictate how well the healthcare providers can improve their quality of care based on specific types of measures, such as reducing hospital readmissions, using certified health IT people, and improving some of the aspects of preventive care, because that really is a big cost saver, and most people in healthcare are really not equipped to do prevention. So we'll talk about that in terms of the big scheme of wellness here while we're going through all of these programs. So how can wellness actually define a portion of what we call value-based healthcare? Number one, a health club is open regular hours, and most health clubs are open from 5 or 6 in the morning till 7 or 8 at night, and there are many health clubs across the United States that are actually open for 24 hours a day, one of them being 24-hour fitness. You get that? People like personal trainers, health coaches, and dietitians, nutritionists who work at health clubs are very professional. The programs, in many cases, are fun to do, and they have an outcomes. They have a defined goal. And a lot of that is, in most health clubs, we'll take one aspect, and that's weight loss. If you take a specific type of exercise program and you want to lose 10 pounds, you can go over to the fitness desk and you can get a body fat measurement. You can step on the scale every day, and your trainer or your fitness instructor will write down that information in your chart. They may actually, be able to tap it into your phone now, because many health clubs have apps and IT programs that can be done on your phone or on computer as opposed to writing things down. So clients look and feel better. Members will refer other new members to the club, and they become a part of this community. And the community can be more than just going to an exercise class. It could be sitting with people at a juice bar. It could be having an outing where you do something with other club members. It could be going to some sort of an event at the club after hours. So you become part of a different type of community as opposed to a health center like a neighborhood clinic or a hospital where you go when you're sick and you deal with a bunch of people, and as you become better, you have less and less interaction with them. The benefit that I see from the health club from a community standpoint is that you can go anytime you want when they're open for more than just exercise. It becomes part of a community program that is beneficial. So what's next here? One of the interesting things that I read in the Optum white paper recently was this quote, and it states, "The goal is straightforward but ambiguous. Replace the nation's reliance on a fragmented fee-for-service care system with a comprehensive, coordinated care system using payment models that hold the organizations accountable for controlling costs and quality gains. This is driven by data on hospital readmissions, adverse events, patient engagement, and much more." So essentially what this Optum paper is trying to state is that in order for the inflationary aspect of health care and health plans not to continue to go at 16, 17, 18% a year where it's going to bankrupt our economy, is that they have to sort of put the brakes on now and look for different models that are going to be very cost effective. And they want to do this by using data on things like, one is hospital readmissions, which are very costly. That is one of the big ticket items that health plans want to look at. If someone goes to a hospital and they have a procedure, we want to make sure that they're doing something different in their lifestyle, that they're not going to have more of a chance of going back to the hospital for a secondary complication, an infection, or having the same procedure done over again because it might not have been done right the first time. We also want to make sure there are no adverse events and the person needs to be engaged. Well, I'm going to always bring it in this episode back to how we're looking at health clubs, because health clubs, you're engaged every time you go in. You can't go to a step class or a spinning class or any type of aerobic class or even working with your trainer where you're not engaged almost 100% of the time during your session. So that's the big difference that I see between healthcare, which is more of a passive system, and wellness and health clubs, which is much more of a participatory and engagement endeavor. Well, this means that hospitals, this quote here means that hospitals are desperately trying to control ever-rising costs through an outcomes-based type procedure. The problem is that almost all hospitals and health systems rely on a plethora of services to keep their doors open. And I'll give you an example here. My mother had a surgery about 1.5 years ago, and she went to a very large medical institution. And she saw physicians, she saw physician assistants. She had to go back 2 or 3 times in a week before her surgery. When she got there, they had to do, all of these people were involved in all of these types of things that were involved with pre-op and the actual procedure and post-op, and she was given a medication that she had a reaction to, so she had to stay overnight. So all of the things that went into her surgery, and if she would have been 20 years younger, it would have been an outpatient surgery. She would have had it at a doctor's office and she would have gotten her car and gone home. But because of her age, they did it as a surgical procedure in a hospital, and it just, again, a plethora of things happened to her, and a 4 or 5 hour procedure wound up being 1.5 days. So this is what we're looking at. The hospital doesn't really care because all of the procedures that she did have done, they made money on. So she had a night in a private room, which was probably about $2,000. So the hospital that day made an extra $2,000 on my mother just by virtue of having her stay in a private room because she had a reaction to a medication after her surgery, which should have never happened. So it's a cascading of events that happen. So we're going to try to put the brakes on here. How are we going to solve this puzzle through wellness? So let me go through the sequence of events that I think might be very helpful in terms of kind of putting the brakes on this runaway train. Number one, we want to develop prudent assessment tools. And in wellness, they're very simple. Their breathing, their posture, their pain management. We can do blood values. We can do fitness measures like strength, endurance, and range of motion. And getting back to the blood values, most people would say, well, wait a minute, Eric. Health clubs don't do blood testing. Hospitals and doctors do. And I say to people now, well, over the last few years, anyone can do a blood test. You can go to companies like WellnessRx or Step One Health, both of which are online, and you can actually order your own blood test as a consumer, go to a local blood lab in your town, and get the results within 48 hours. So technology now has made it possible to sort of circumvent or bypass the healthcare system in order to get blood tests, which may have tremendous ramifications on your wellness program. And I remember last season I had Dr. Craig Brandman from Step One Health, which is one of the top online blood lab companies in the United States. And Dr. Brandman said that over 90% of physicians' decisions are based on the results of blood labs. And so my question to him during the interview was, well, how many of those decisions could be made by the personal trainer or the nutritionist or the dietitian based on those same blood labs? And we want to be careful that we're not diagnosing a disease, but if we see someone with a high cholesterol or high blood fats, we can make a nutrition recommendation. And if we see a person who comes into a health club with an A1C level of 8.9, we certainly know that a good quality exercise program over 3 months may reduce that to 6.9. Tremendous information that now the people in wellness have. So we also have detailed exercise and wellness plans that are both individual, but they're protocol based. So in diabetes, the protocol is they may do a combination of strength, endurance, and range of motion, but the protocol is that we'll be testing finger stick blood sugars, we'll be looking at their blood labs every 2 or 3 months, we'll be communicating with their physicians, we'll be doing their body fat. So it's a protocol that they have to go through, even though their exercise program might be a little bit different than the other person with diabetes who's working out in the same class. They want to have specific outcomes for each medical condition that the trainers are working with. So a person who is a cancer survivor is going to have a completely different type of protocol than someone who's in weight loss or diabetes or hypertension care. They're all going to be different because they all have their own sort of series of events that trainers will be working on to make sure that that new member, will enjoy the program, but they'll also know that there's certain things that we want to monitor and measure to make sure that the program is going along very good. And the last thing we want to look here is the cost of assessments, the cost of programs, the cost of their membership, and other types of costs, whether they're nutrition or having someone else come in and talk with the new member. And you want to compare that to a health system expense for the same type of thing. So a dietitian in a hospital may get reimbursed $100 for a 15 or 30-minute session, whereas the dietitian or the nutrition coach at the health club may get reimbursed, or they may get paid $15 or $20 for that same 30-minute session. So the cost differences for the health club membership, which is maybe between $35 and $75 a month, for the personal trainer, which may be $40 to $60 a session for a certain package of sessions, most of those costs will add up to a few $1,000s a year. And we know from my mother's experience that sometimes one night in a hospital may cost $2,000 or $3,000. So the amount of expenses that a health plan may pay are going to be completely different if they reimburse partial cost of a wellness program versus what they would typically do for health and medical centers. So let's look at an example here. A person with type 2 diabetes, they have a full blood panel. If they go to a hospital system, they talk with a diabetes educator, they talk with a dietitian, they learn about insulin regimes, and in a 1-week program may cost thousands of dollars for their doctor, dietitian, and certified diabetes educator, and anything that a nurse may also have to do with them. So the outcomes that they're going to be looking at for this program are how they manage their insulin, how they need to change their diet, how they need to reduce their body weight, they need to understand their A1C, they need to learn how to change their blood sugars, they need to do a lot of different things, and they have all these people who are helping them out. Now, if we compare that with a wellness system, the outcomes measures here are blood sugar, A1C, body weight, eating patterns, sleep, and cost. But we're going to do this through a 3-month program of exercise and nutrition, right? And it's basically lifestyle management. We're going to be looking at the same things at the end of 3 months, like A1C, fasting blood sugars, their blood panel, their body weight, their body fat, their quality of life assessment. All of those things are going to be looked at, but they're going to be looked at based on how much that this person is paying to be in a wellness program versus another person who has the same condition, who decides that their doctor and their health medical center are going to take care of everything. The costs are probably 10 to 20 times higher for the medical center to do most of the same types of things. Well, let's get back to Optum. They state that there will be 50 million price-conscious consumers who will enter the healthcare system by 2020. Well, it's already 2018. We got a little more than 2 years before we get an extra 50 million people. That's 16 million people a year. All of these people will need health care. This means drugs, surgeries, hospital stays, and other medical concerns and issues. So if we take a percentage of this 50 million people and we place them into wellness care, what are we going to look at? Well, they need to prevent diseases that may occur with aging. They need to manage and improve their current conditions that they're dealing with now. And lastly, the consumers, they want to find sort of a new groove with their aging process. They want to do something different. Many of them have retired from work. They need to kind of understand what they can do to become healthier at 75 or 80 than they were at 60, 62 when they retired. Optum says the expenses for healthcare are expected to rise from the current $350 billion a year to $550 billion in the next 10 years. Well, that represents $200 billion increase or $20 billion a year. My question to you, the audience, this is healthcare savings? I mean, these people are budgeting and managing for healthcare costs to increase over $10 to $20 billion a year. And as the aging population increases, I think it's 10,000 people a day turn 65, these numbers aren't going to go down, they're going to go up. And we are going to bankrupt the system. And we're going to bankrupt it in a lot of different ways. But we have our work cut out for us in terms of saving money through wellness. We need to show the average consumer the value of fitness programs over prescription medications and decreasing the cost of healthcare by shifting disposable income to wellness programs, which is either a standalone facility, a hospital joint venture partnership, or a hospital-based fitness program. So how do we solve this issue? Patient satisfaction has always been a part of quality healthcare, but what does it mean? Well, I like my doctor, I like my therapist, my stay at the hospital was fine. Well, that might be true in many cases, but a lot of people today are very unhappy with their health care. Mostly they get a prescription for drugs, more drugs, and surgeries. And those are basically what doctors now do as the crux of their business model. All of these things are becoming more expensive, not less expensive. And if we look at just a couple issues with the opioid crisis, the EpiPens, and certain types of prescription drugs that have gone up 300-400% in the last few years, we can see that we have a big problem. So, to successfully manage total cost of care, providers must have the processes in place to drive to more preemptive and predictive improvements, coordinated, consistent approaches for managing health of all of their patients. So let me paraphrase that for you. In order to save patients and consumers and taxpayers money on health care, they should become involved with wellness programs because they cost 90% less than most healthcare programs. All right, the concept of a provider network is one that Optum really is embracing, and they state it should improve cost and increase choice. Well, health clubs could become a provider network. In many states, they already are. The Silver Sneakers program has over, I think, 9,000 health clubs in their network. And today, there are 31,000 health clubs in the International Health and Racket Sports Association network. There are over 300 personal trainers, according to the Bureau of Labor Statistics, and there are over 400,000 massage therapists in the United States, according to the AMTA. So if we look at all those providers, they could be providing a huge service at a much more reduced cost than current healthcare programs now in hospitals and clinics. So how will healthcare improve these costs? They're going to standardize their data. They want to apply data analytics, and they want to transform payment methods. Well, the health and fitness industry already has the infrastructure to apply the care. What they need to do now is to have some level of a population health management model which will look at current programs like diabetes, cancer, etc., and say, well, how well do these programs work over 3 months and over 3 to 5 years? And then we can also look at programs for cancer, high blood pressure, and the big one, which is weight management, which is what most health clubs want to be engaged in on a regular basis. So healthcare dollars in the form of reimbursement and contracts is really a secondary source of revenue for these health clubs because remember, most of them earn their money through memberships. So they're not going to go out of business if they only have one clinical program. If they have a weight loss program, well, that's what they have. They're not going to go out of business, but a weight loss center in a clinic that has thousands of patients a year on an OptiFast diet, if half of those patients leave, that business may go under. So Optum has a four-prong approach for achieving their financial stability. They call it risk and contract optimization, which is essentially networks. They want to have a provider network management, which they really look at physician networks. They look at care coordination, which is appropriate admissions and really things about the hospital setting, managing care, data-driven population, health strategies, etc. So they want to sort of control how people go in and out of the hospitals and the clinics from a data analytics standpoint, because a lot of these expenses, they don't really know where they're going because they don't have a handle on them just yet. And the last one is quality and clinical integration. They want to track performance. They want to identify the intervention and understand how they can change the payment schedule thereof. So the health and fitness community can actually compete directly through their existing and expanding networks. They need to really get involved in population health management, and that's really what medical health and fitness is going to be all about here in the next couple of years. We're working actively with a number of large health club chains to help them look at the data analytics and the population health management of their programs from the standpoint of, oh, you're already doing a program? Let's get that published in a medical paper. Let's do some white papers for you. Let's make sure that you, the health club chain, understand what you're doing in terms of how it's going to be beneficial for healthcare. So we're going to solve the crisis by cost shifting, not from one healthcare entity to the other, but from certain healthcare propositions to wellness. And it can be done from medical centers and physician groups and doing direct-to-consumer advertising that's really going to be talking about wellness. All right. Exercise, massage, acupuncture, meditation, stretching, and nutrition. We've talked about all of those on this show over the last 3 or 4 seasons. So you can go back and look at some of our things. But in closing, I want to say that we want to develop current and future post-rehab programs. We want to analyze the data through population health management. We want to expand relationships with health plans. And we want to work more closely with medical providers in local areas. That's what's going to solidify how wellness can become a really true player in tomorrow's healthcare system. So this is Eric Durack for MedHealthFit. Thanks for watching this very detailed episode, and we hope to see you soon again on MedHealthFit.